Hi, I'm Dr. S C Yeoh. I'm an oral medicine specialist in Sydney, and I'm very happy to be able to join you for Injured Worker Wellbeing. Today, I'd like to talk to you a little bit about medications, particularly prescription medications, and how they can affect the mouth. So I'm just going to share my screen with you. And I hope that you can see that clearly. So when we talk about the mouth, we talk about two different areas. So we talk about the soft tissues of the mouth, and this is basically the lining of the mouth. So the insides of the cheeks, the roof of the mouth or the palate, the tongue, the gums, and further back into the throat or the oropharynx. And we also talk about the hard tissues. So in the mouth, this obviously covers the teeth, but also the jaw bones in which those teeth sit. There are many effects of medications on the mouth, and we only unfortunately have time to go through the most common. So things that we're going to talk about is dry mouth and the implications for the teeth as well as the lining of the mouth. We're going to talk about lichenoid reactions, and these are things that affect the lining of the mouth predominantly. We are going to talk about the gums and certain medications causing gingival enlargement as well as pigmentation. We're going to talk about taste alterations and how this can affect patients. Some people can develop non-specific ulceration of the lining of the mouth. There is a condition called medication-related osteonecrosis of the jaw, which we will talk about today as well. And then we're going to touch on how medication can affect tooth development. So dry mouth is probably the most common side effect of many medications. And you can see from that chart on the side that there are so many drugs that list dry mouth as a potential adverse effect. We do know that it tends to be a cumulative effect. So the increased number of medications that a patient is taking relates directly to how severe their dry mouth may be. The medications that cause dry mouth in terms of, who is the worst offender, well, we know that the anti-anxiety drugs tend to cause significant dryness. The anticonvulsant drugs are also very much implicated in this condition, as are the antidepressants and the antipsychotic medications. Additionally, we know that patients taking sedatives very commonly complain of a dry mouth. So how can this present in the mouth? So common symptoms, obviously, the mouth is usually very dry on waking. All of us will remember waking up in the morning and and feeling that the mouth is quite dry. Patients that have medication-related dry mouth will often say that when they wake up in the morning, their tongue is stuck to the roof of their mouth. It is very uncomfortable. They will often need a sip of water just to help them along their way. Patients with dry mouth often complain about alterations in taste. Some patients find it very difficult to swallow food, particularly dry food, and they often need a sip of water with their meals. Some patients will have difficulty speaking, so they will stumble over their words, or they may develop a little bit of a lisp. Those patients that wear dentures very commonly find that the dentures don't stay in place very well. They may move around and make it quite difficult for the patient then to eat. Patients will complain about halitosis, and what that means is essentially bad breath, and this is very common. And some patients will also develop discomfort of the lining of the mouth. This lining is designed to be wet all the time and lubricated, and patients that have a dry mouth often say that their mouth feels like it's stinging or very raw. In terms of objective signs, if a doctor or a dentist were to look in the mouth, what would they see? Very commonly, the lining of the mouth would appear dry. So we like to usually see that the lining is wet and glistening with saliva, and sometimes when we look in patients' mouth, there is basically no saliva at all. Unfortunately, this means that the lining then becomes very fragile and quite often painful. If there is some saliva in there, it's not that nice watery saliva. It's actually quite thick and frothy, and it will coat the tongue or other soft tissues in there. Patients with a dry mouth are prone to developing several oral infections, and basically the most common of this are fungal infections relating to Candida. So Candida is a fungus that most of us have living in our mouth, and it lives there very happily and in harmony with the 50 million other bugs that we've got in there. And sometimes when the mouth is dry, the Candida has an opportunity to overgrow, and it can then cause a problem and cause an infection that we can see. Some patients with long-standing dry mouth can develop what we call hairy tongue, and that's a very interesting phenomenon, and we'll have a look at some photos in a second. Sometimes the tongue can appear quite red. And we do know that saliva is very protective of the teeth, and so patients that don't have enough saliva do tend to get accelerated tooth decay. So some photos, that top photo, as I mentioned before, that's a photo of hairy tongue. So you can see that that top surface of the tongue has developed this sort of, furry appearance. And if you look closely, you can see these little hair-like projections. And what this is basically those taste buds on the top surface have overgrown and have developed this elongation of the surface, and this projects into the mouth. And because it's so prominent, it sits there and collects everything. So it collects dry saliva, it collects shedding cells, it collects food, and it can become quite thick and coated. The photo underneath shows a patient that has developed a fungal infection, so oral thrush, and you can see those white sort of curds that appear on the palate. The other two photos show patients that have developed this accelerated tooth decay. And you can see particularly in the top photo that all those front surfaces of the teeth have been affected by decay. That lower photo shows quite a large hole in one of the lower molars. So this pattern of decay is very common in patients that have long-standing dry mouth. Fixing it can be quite difficult, so sometimes a dentist is able to restore these teeth with fillings. In severe cases where the teeth can't be restored, patients may require extraction and then replacement of those teeth. Another thing that can affect the mouth in relation to certain medications is what we call lichenoid reactions. So these are inflammatory lesions that affect the lining of the mouth. And you can see in those two photos that some patients can develop these white reticular or spiderweb appearance on the lining. So obviously on the top photo, it's of the inside of the cheek, and in the bottom photo, it has affected this patient's tongue. It can also appear red. Sometimes it can be ulcerated, so that bottom photo shows this ulcer on the side of the tongue. Some patients can also develop blisters. It can obviously be quite painful, and particularly that stinging or burning sensation. Certain drugs we know predispose patients to developing these, so the antihypertensives, which are used to manage high blood pressure, certain anti-inflammatories, particularly the non-steroidal anti-inflammatories. There are certain antidepressants that can also cause this type of reaction, as well as some anticonvulsant medications. Some patients taking prescription medications can develop gingival enlargement, and that top photo you can see that there is significant swelling along the gums. This type of swelling is usually generalized, so it can affect the upper as well as the lower gums. And obviously, because the swelling is so prominent, it can be quite difficult for people to keep their teeth clean. It can also be quite uncomfortable at times. Drugs that commonly cause this type of reaction, so the antihypertensives again, so the calcium channel blockers particularly, certain anticonvulsant drugs that are used to control seizures are also implicated. The lower photos show a gentleman that has developed pigmentation in relation to medication that has been used to help with his environmental allergies. And you can see in his case that there is this dark pigmentation which is affecting the lining of his upper and lower lips. It can affect any of the soft tissue lining, so not only the lips but also on the roof of the mouth and inside the cheeks, and also sometimes on the gums. It usually presents as a dark brown or grey discoloration and is usually not tender. Many patients will talk about taste alteration, and this is quite a common effect of medications, and it seems to be more prevalent amongst the elderly patients who are taking multiple medications. Patients say that their food doesn't taste the same. Many develop a metallic or a salty and bitter taste in their mouth. And we know that a certain group of antihypertensives called the ACE inhibitors tends to be implicated in this, along with the non-steroidal anti-inflammatories, as well as certain antibiotics. These photos show a patient that has developed non-specific ulceration of the lining of the mouth. So the first photo shows the undersurface of the tongue, and the second photo shows the inside of the left cheek. These are known side effects of certain medications. So this one in particular has been a result of the patient taking methotrexate. Now, methotrexate is a drug that is commonly prescribed to manage rheumatoid arthritis, but is also used as chemotherapy for certain malignancies. I'm going to talk now about medication-related osteonecrosis of the jaws, and this is something that has come to light fairly recently. It was first described in 2003, and we know that knowledge in this field continues to evolve, so we don't have all the answers yet. It is an adverse effect of particular medications, and we know that the anti-resorptive drugs and the anti-angiogenic drugs are particularly implicated in this disease process. So anti-resorptive drugs are drugs that include the bisphosphonate medications and denosumab, and in Australia that's trade name Prolia. And these drugs are often used to manage osteoporosis as well as some cancers. The anti-angiogenic drugs are drugs that are usually injected, and these interfere with the formation of new blood vessels and are used predominantly in the treatment of some cancers. Patients will commonly present with areas of exposed jawbone, and these don't heal. Most commonly, this occurs after some sort of dental surgery. So you have a patient that has been on these medications, they then go to the dentist and require some sort of surgery, and that might be a tooth extraction, sometimes that might be a placement of an implant. Patients can also develop these following trauma. So if they have a denture, for instance, that isn't sitting very well and it's rubbing along the gum, that can be enough to trigger this condition. There have been cases that occur spontaneously. So I mentioned previously that the bisphosphonate drugs and the denosumabs, the rank ligand inhibitors, but there are other drugs that are implicated in this condition. And this is probably a more comprehensive list with some examples. This is a publication that is available through the Australian Dental Association. I'm more than happy to distribute that if anybody is particularly interested. So how do patients present? So I mentioned before that they often come in with areas of exposed bone, and you can see in these three photos that these patients have obviously a breach in the lining of the gum, and and you can actually see that white stuff or that yellow stuff is actually the jawbone, which sits underneath the gum, which is now exposed to the oral environment. So these are relatively small areas of exposure. You can actually get very large areas of exposure. So here's another couple of examples. That top photo shows, again, a relatively small area of exposed bone. The photo immediately under that shows a much larger area, and you can see that there is some pus present. So there is some infection as well. And then the photo on its own, stage 3, shows almost the whole lower jaw, which has been exposed. And that's obviously a very severe case. So what happens to these patients when they've got this exposure? Very commonly, as you know, the mouth is full of bugs, and once there is a breach in the lining of the mouth, the bugs from the mouth can then enter and cause a significant infection. That then causes pain and swelling. In severe cases, patients can actually develop fracture of the jaw. Patients will commonly require some sort of intervention, and that may be a little bit of surgery. So in minor cases, it might just require removal of a mobile, loose sequestrum or piece of bone, and that's enough to help it to heal. But in the cases that have jaw fracture, then obviously they require much more extensive surgical intervention. Finally, I'm just going to talk about medication and how it can affect tooth development. So we all know that the permanent teeth start to form in the jawbones very soon after birth. And during this time of their formation, they are very vulnerable to certain medications. In particular, tetracycline, which is an antibiotic that used to be used quite extensively a number of years ago and probably less so now. But this will cause permanent discoloration of the permanent teeth. So you can see these photos down the bottom where there's yellowish, brownish discoloration of the teeth. And very commonly, adults who have this type of discoloration will require dental intervention, both to protect the teeth and strengthen them, but also to improve the appearance of the teeth. Another common developmental condition that can occur because of medication is fluorosis. So excessive amounts of ingested fluoride can actually cause this. So whether that's somebody taking fluoride supplements, whether that's somebody that is inadvertently swallowing excessive amounts of toothpaste which contain fluoride during that period of their life when their permanent teeth are developing, they can cause this white or discolored spots to occur. Again, this is a permanent phenomenon, and very commonly, particularly in severe cases, patients will actually require dental intervention to both strengthen the teeth but also to improve the appearance of the teeth. So I'm more than happy to receive any questions, comments, or further discussion from anybody. I have listed my contact details here on this slide. I'm very happy to hear from you. Please don't hesitate to call me or pop me an email. Thank you very much.